Welcome back to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we are going to pack up the ultimate natural labor toolkit. Whether you're looking to have a natural birth or just looking for more ways to stay comfortable during your labor and birth experience, this episode is for you. We are going to unpack, even though I just said pack up, but we're going to unpack these tools so that you can decide what to pack in your tool bag for when you go into labor and birth. A lot of these tools are hands-on, some are mind and body, some require a partner, most likely your spouse or a doula in the room. But these are all going to be really awesome tools that I think a lot of you, and I know a lot of moms have used during their labor and birth and have had really positive experiences. So let's get right into it. I want to start with why you might be experiencing labor pain, because labor pain is real, but it's not random and it's not unavoidable. It's going to happen to some degree. But understanding why pain is happening during labor can help you better prepare and feel more confident going into labor and birth so that when those pains arise, you have options and tools and a better understanding. You've already processed what this pain is and where it's coming from so that you can overcome it in the moment. So let's start with some reasons of why you might be feeling pain. Cervical dilation and cervical effacement is probably the most obvious. We are taking your cervix and, well, let's just start with your cervix. We're taking your cervix from 0 centimeters to 10 centimeters. That means when an OB or a midwife is doing a cervical check, if they do a cervical check and you're at 0 centimeters, if you put your hand all the way together and try to stick your finger through that opening, that's 0 centimeters. You can't stick your finger through. 10 centimeters would be wide enough that you can take 4 fingers in there and go outwards. That's a lot of movement. That's a lot of space to make in your body in a rather short amount of time. Effacement is the thickness or the thinness of your cervix. So 0% means it's as thick as it could possibly be. It's what my cervix would be right now, not pregnant. At the very end of pregnancy and into labor and birth, when we have 100% effacement, that means our cervix is at the thinnest it could possibly be so that the baby could come down. So that change just in the dilation and the effacement is having the cervix open up and thin while your uterine muscles are working. It can create some pain sensations, and not just some, usually quite a bit. Baby's positioning and descent. So if baby's in a funky position, it can cause different pains throughout labor. So for example, the most common one that we see is OP. If your baby is OP, that means the back of your baby's head is close to the back of your spine, so you both are looking outwards. Spine on spine is a lot of pressure for mom, and that is where we hear, I had a lot of back labor. That's what typically the baby's position is, or that's typically what the baby's position is when you're experiencing back labor. Not always, but that is the common position for a baby at that point. Other different descents, if baby happened to be breech and is flipping upon descent, can create some pain. There's other things. Your baby is trying to get out of your body. They're literally pushing pushing off of your diaphragm to push out. So there's going to be pain just in general with your baby's position and how they're coming out. They have to work their shoulders in and around really exhausted muscles at this point of labor and birth to get out, and there's typically some more pain with that. We also talked about this in this past weekend at the Better Birth Outcomes seminar, is the burning sensation. As baby descends, depending on how fast baby descends, there can be a burning sensation before baby's actually crowning. That is not the ring of fire. We'll do a whole episode on the ring of fire one day, but there can be some burning. That is just the tissues stretching and trying to make space as baby's coming down, possibly quickly or in general, just coming down. We also have uterine contractions. So before we even talk about everybody's nuances in uterine contractions during labor, I want you to think about your period. Every girl has different experiences on their period, but we always have those friends who have really bad cramps. I know a couple girls who always have really bad cramps, and it could possibly even take them out for the day where they need to stay home. I have other friends who have never had a cramp on any period ever. So, uterine contractions can be the same. Before we talk about any interventions with uterine contractions, if we were just all unmedicated and all were experiencing uterine contractions, we would all experience different amounts of intensity and amount of tension that our bodies can create with that uterine contraction. All the daily activities that you do, how you sit at work, all of those small things lead up and affect the way your body's able to contract and push a baby out. So if you, for example, are a runner or a cyclist or a dancer and you have a really strong lower body and toned pelvic floor, it can take a while for baby to come out, but you also might have really strong uterine contractions because your body's so strong in that area. That can either increase pain, but it could also shorten the time of labor, getting baby out a lot quicker just because of the sheer strength of the uterus and the pelvic floor muscles. Everybody's different, but that's why I want to start with uterine contractions in general are going to be different across the board. Some are going to be more painful than others, just as a general rule of thumb. Now, when we have interventions like Pitocin, because it's synthetic, is coming into your body and being used at a rate that is outside of your natural rhythm. That's why it can be really difficult for your body to synchronize with Pitocin and actually be able to send the natural pain relieving signals that your body has when you have a contraction, because it's not in sync with the natural oxytocin that your body should be producing or is producing at the moment. Pitocin will override that oxytocin, and then we have this asynchronous rhythmical contraction and nervous system stimulation for the natural pain relievers that your body has. So, once we disturb that, it can be really difficult and really hard contractions just because your body is not able to send those natural pain relieving signals as quick or as frequently or on time with the contraction. Next, we have the pelvic and lower back pain. Like I said, depending on your baby's position coming down, there can be a lot of pain just on the structures in general. Now, there can be a lot of other pelvic and low back pain if we're not changing a lot of positions. This tends to be when we are immediately, and not always immediately, but in a bed, or in a bed for a long period of time in one position. It's really hard on the body to experience this amount of intensity without a lot of motion to release the energy or change what parts of the body are receiving and releasing that tension that comes through with a contraction. The next part I have is mental and emotional factors. Stress can increase the pain sensations that you feel during labor. It's really important that stress and fear are minimized as much as possible. I talked about this in a couple episodes, or a couple episodes ago, about keeping the room as undisturbed as possible for the fetal ejection reflex. In order for people to feel safe or moms to feel safe in their birthing space, the entire environment has to be held as a safe space. That means minimal distractions, minimal people coming in, low lighting, maybe soft music. It usually smells good. All those small things can reduce and take away that stress and fear, which can reduce and take away a lot of labor pain. So, that is something else to think about. If something changes in the labor room or the labor space, and all of a sudden mom is feeling a lot of pain, what just shifted in the room? Is there anything that you can shift back to bring her back to a really safe, comfortable space so that that pain starts to come back down? That is pretty much what I have for why you might be experiencing pain in labor. There are so many different reasons why you could be experiencing pain. Those were just a few of the really basic ones that go across the board for most labor and births. Um, but if you have any specific pains that you would want me to talk about or dive deeper into why they're happening, please send me a DM or drop a comment and we'll talk about it. Now for the fun part, let's get into the tools. So, yes, some of these are physical tools that you need to put into your bag, and some of them are just ones that you need to practice and really get into your mental tool belt so that when you're in a really intense situation like labor and birth, you can still pull those tools out of a tool belt even when there's a lot going on. So the first one I have is a comb. This one I put first because every time that I put it on my Instagram story, I always get a bunch of questions. What is the comb for? What is the comb for? So there are a lot of acupressure points in our hands and our feet, all over our bodies. In our feet, there's a lot of acupressure points that can help induce labor. In our hands, there's a lot of acupressure points that can help reduce pain during labor. However, I'm guessing most of you are not acupuncturists. Neither am I. However, we want to still try to find these really nice points in our hand. So we're just going to try to go for all of them. If you can get a comb, which I should have brought a comb to show. So if my fingers pointing up are the teeth of the comb and the bottom is the soft part, I would put the teeth of the comb into the palm or close to where my fingers meet the palm of my hand, and then I would wrap my hand around it, and usually the palm should be able to get around the back side of that comb. Be thoughtful of the size comb that you're getting. I'm thinking of a really classic, like black comb where the teeth are really thin on one side, they get bigger as they go to the other side. Should fit right in your hand. Squeezing those teeth in your hands, or the teeth in the acupressure points in your hand, can start to really reduce the pain that you're feeling, or at the very least, redirect the tension and discomfort that you're feeling to your hand and out of your pelvis. Yes, I know that's a lot of expectation for a little comb to take all the pain sensation that you're feeling in your pelvis up to your hand. However, it might not take all of the pain away. It does help redirect some of that pain and tension into another spot so that your pelvis or your brain can take a break from thinking about how hard your pelvis is working in your uterus. When to use this? I suggest using this during the peak of the contractions. Keep it in your hand or near the bedside table if this is a tool that you really like. And as soon as it starts to get really tough, put the comb in your hand, squeeze it. Tough as in, contraction is coming. Usually you can feel the contraction start to ramp up. Get the comb ready and don't squeeze it until you really need to squeeze it. And then you'll get the most benefit out of using the comb. The next one I have is the TENS unit. The TENS unit is really cool because you can have one, your doula can have one. Usually hospitals have one or two. I do recommend it if you have a hospital birth to bring your own TENS unit, because the only time that I specifically had, I didn't offer it. One person, I've only had one mom say, "I want the TENS unit." Where I didn't offer it first. And when she asked for that TENS unit, I was asking the hospital staff where the TENS unit was, and it was not charged. So I would just suggest bringing your own just in case. You can get them pretty or fairly cheap on Amazon. Anyways, a lot of doulas have them too. I think birth centers typically have them, but again, this is something really simple to have. It's nice to have in the house anyways. Go ahead and get one for yourself. The TENS unit is very similar to if you've ever been to a chiropractor or a physical therapist who has done e-stim on your back or a part of your body that was in pain. E-stim stands for electrical stimulation. So sending small electrical stimulation to the area. This, similar to the comb, can redirect some of the tension and pain, but it also just redirects stimulus. Since your pelvis in the lower part of your body is being very stimulated in a pain sense way, where I've seen most people place TENS units and where we've used them is on low back or around the hips. This should bring some of the pain and tension out of the lower part of your birthing canal into a different part of your back. It also just starts re-stimulating a lot of brain to body communication, especially when there's been a lot of position changes and just hard contractions in general. Remember, we always want to make sure that the brain is able to speak to the baby as much as possible. And a lot of times, this TENS unit can just bring the body back to a place where it can get that nervous system communication once again. The times that I check or I'm offering to get the TENS unit out is usually when we're doing a lot of back labor or there's been quite some time sitting on a toilet. I don't know why that is always the case, but it tends to be the most useful that I've seen as soon as we've gotten off the toilet and or we've had a lot of time laboring on our backs, even if it's in the tub. Like even if you're sitting and laying back on a tub, that can be for a long time, that can be pretty uncomfortable. It can be pretty uncomfortable on your low back. So we like to use this at those times, have one available. If you have a doula, they'll usually have one and suggest when to use it as well. If you do have a doula and you think you might want one of these, ask to see if she has one. Next, we have a scarf or a rebozo. The scarf is used typically all over the body. It can be used on the belly. It can be used on the hips. The most frequently way that I have used it is on the hips when mom is in all fours or in a seated position, or even side lying. So what I typically use the scarf for is I'll wrap it over their hips and I'll shake down. You'll see a lot of videos like this on Instagram. This motion that you see is and can be called shaking the apples. You can use your hands or you can use a scarf. Both are really, really useful. However, when you're doing this, this is typically at the end of a contraction. When you have such an intense contraction involuntarily, there's a lot of muscles that take time to relax. And that's where women are looking for a break from the contraction. And if it takes a long time for your body to relax from the contraction and then the next one starts again, it can feel like you're never getting a break. So, being able to shake out the tension from the contraction is really helpful for being able to overcome the next contraction. We take the scarf, we put it on the hips. Mom finishes the contraction or she's mid contraction if you're not using it during the contraction. I'll be honest, we use it throughout the whole contraction, but I feel like the most benefit we get from it is at the end of the contraction when we're trying to release the tension from mom's hips. So we'll use it on the hips, we'll shake it out. Usually I don't keep shaking it out. You can usually tell when a mom's done with the contraction and the tension has released. And then usually we'll be hands off until the next contraction. This isn't something that is used the entire labor, but it can be used in so many different ways. I've had moms who end up asking for an epidural and needing to labor on their backs where they can't get out of bed much. And they've asked for different ways to birth so they're not just straight on their backs. And we've added a pushing bar where in the bed there's a big bar that's put over basically where your hips would be, and they drop the lower part of the bed. So you can hold on to the bar, you can it's a squat bar, not a push bar. You can hold on to the bar and squat. We have used it where we put the scarf over the squat bar and mom holds onto the scarf while she's laying on her back, feet on the squat bar, and she uses the scarf to pull herself up for different contractions or for pushing. You can use that throughout all parts of labor. You can use it in early labor, you can use it in active labor. Just like I said, you can use it in pushing if you're using it to pull yourself up. But scarf, it's awesome. Then we have a peanut ball. Peanut balls, also great, just like birth balls. I at first could not understand the difference or why we would need a peanut ball versus a birth ball. And then I went to my first birth and I was like, oh, we need the peanut ball. So the peanut ball is really great, especially if you're laying or doing any positions in bed. It can be really helpful for all the contours of a pregnant mom's body to support her while also keeping her in all fours or giving her upper body some rest. I have seen it most often used in all fours with mom resting her chest on the peanut ball and then also laying on her side in the bed where her knees are over the peanut ball. Knee is on the dip of the peanut ball and the foot's on the top part of the peanut ball so that mom's hips can get some internal rotation. When we do internal rotation, if you can see through our birth canal, internal rotation actually, and you really have to picture this, when your femurs turn inwards, it's going to pull your hips outwards like this. It's going to create more space for baby to descend down. So the peanut ball can be really helpful if mom needs to help baby descend down further before she's ready to push. Laying on the peanut ball, typically they'll have you switch side to side every 30 minutes so that your body doesn't get too tired and so that each side of your uterus or your cervix has a chance to take a break from holding the pressure of baby. The peanut ball can be used pretty much throughout all of labor as well. I see it most often used in the later stages of early labor and then in some active labor positions. Next, we have the birth ball. The birth ball is probably our earliest tool to use when we're in early labor and we're just trying to get to active labor. This is where we can do a lot of movements to help baby descend straight into our pelvis and into the birth canal. So, these are also just movements to keep your body moving and keep your body in rhythm so that you can actually get or move into active labor. Birth ball, if you're not already using it during pregnancy, get yourself a birth ball and start moving on it because it's really helpful, especially in labor, if you decide that you want more support other than holding on to things. The birth ball is a really great tool just to have for, again, like the peanut ball, all fours if you want to sit on it. At some point during labor, there's going to be enough pressure on your pelvis that you probably don't want to sit on the birth ball. So that's why I always say it's usually used for early labor mamas when they need some sort of tool to just keep things moving along. The next one I have is massage. And I think of massage more as physical touch. I think it's just more beneficial in general because not only are you getting the massage, but you're also getting oxytocin flowing. Um, Massage can work in so many different ways, and you can get your spouse involved, but also a lot of doulas provide physical touch as well. So, this is definitely something to be practicing with your spouse now so you guys can understand what feels best if you don't already know what small little massages feel best for you and what are feeling good for your body in this moment. Good time to start practicing. Um, you can do all sorts of different massage type things or physical touch for the birthing mom. And birthing moms, you can ask for all sorts of different types of physical touch and massage during labor and birth. The one that I see frequently really helpful is foot compresses, foot massages, and then head rubs. Head rubs, though, I have also seen some moms get very annoyed very quickly by their spouses because the head rub is just like not what they're looking for. That's why I say practice this stuff now so that you can understand mom's ideal pressure and her preferred areas of physical touch. So, because I'm a chiropractor, I like to do a lot of physical touch in and around the neck so that the brainstem is staying nice and open so that the brain and the body can communicate. I think that everybody's different though, and every doula is going to have their own flair on what physical touch they're really good at providing. Sometimes it will come through this massage. Sometimes their physical touch is the shaking that I was talking about with the scarf, but with their hands. So everybody provides different physical touch. It's really good to start to jot down what physical touch feels good to you and what doesn't, so that you can say, that's a no. Like, I don't want my feet touched. Maybe that's you. Maybe it's like, I don't want my shoulders squeezed. Whatever it is, make your yes and your no list for physical touch. Make it really simple so that you guys can look at it and know immediately, but also practice it often so that you don't have to look at any papers and you already know what your birth partner needs. Next, we have, going back to massage tools, the time that I use these are in between contractions. Typically, during the contraction, mom is already feeling a lot and going through a lot, so I'm not going to increase the stimulus in and around her body. But that's usually why I grab the scarf after. and add that physical touch after. It's also just nice to have a break in between the contractions with loving, kind, caring touch. So think about that. You can always, and I'll give you some really fun practice tools at the end of this episode of different ways you can practice breathing through or managing labor. When you practice those tools, you can practice saying, hey, okay, at this point, when my mind is this stressed out from whatever stimulus whatever you're practicing, this is when I could use physical touch. This is when I could use the comb. This is when I could use the birth ball, whatever it is. So I'll give you those tools at the end, or those different practice games that you can play at the end to see how well you're going to be able to manage different contractions and the intensity of the contractions. You practicing being able to call out different tools during those are going to be really helpful, so that when you're in the moment of having the intense contractions, you know what tools you want to call out. Next, we're going to talk about heat and cold packs. Heat and cold packs we use for a lot of things in life. When you hurt your knee or hurt your shoulder, when we use them during labor, they can be used warm for relaxation, cold for numbing pain. I wouldn't say that the cold numbs pain. However, it can redirect pain sensations or stimulus in your body to a different area, such as holding ice, putting an ice pack on the back of your neck. These are great to alternate throughout pregnancy or throughout labor. I see them most often used during early labor and maybe early active labor. They tend to be forgotten about towards transition and pushing, just because so much other sensation has come up. So heat and cold packs are great. They're just another tool. You can always ask for them. Pretty much every birthing place is going to have them. If you are having a home birth, consider having some heat and cold packs ready to go for labor and birth. Next, we have hydrotherapy, which just means shower, bath, birthing pool. These are great. We see a lot of babies born in baths. It's because there's way less pressure on mom. She's in less pain. She's able to get into that synchronous rhythm with her brain and her body of natural pain relievers to natural contractors, all the things that you need to get a baby to come out. Happens really seamlessly in water. That's why, if I haven't talked about it on the Popped podcast yet, we will definitely dive way deeper into this. But if you think you're starting labor, my number one suggestion is to get in the tub. It's called the tub hydration test. Our really awesome doula mentor, Haley McNabb, has taught us, all of us doulas that she has trained, about the tub hydration test and how, one, it's super helpful for doulas to know when to go to births, but it's also really helpful for birthing parents to know if labor is happening or not, so that they're not making a ton of quick calls or rash decisions because they think they're in labor, if they're just having some prodromal contractions or prodromal laboring. So the tub hydration test, if you think you're starting labor or you think you're starting contractions, get in the tub. If your contractions increase, you're probably starting labor. If they decrease, it's probably just your body starting to practice getting ready for labor. In labor, the tub can be really helpful to keep the contractions going, but also reducing the amount of pressure that mom feels on her pelvis. If you think about when you get in a pool, how easy is it to hold your dad up? Really easy, because there's not as much pressure. The weight is a lot lighter. Same with baby. So baths can be really helpful. Showers, just the water in general, the beating water on your back can be a new stimulus. It can feel really good. The temperature can feel good, and it can just change where the body is putting or experiencing sensations other than the birthing canal. Nice. Let's go on to aromatherapy. I see this most often used with doulas. Most of us come with our own essential oils. They can be really, really beneficial for your body's natural instincts to either relax, to soften, to feel safe. All essential oils have different intentions, just like all of our different crystals in the world and all of our different medications, they all do different things. So, essential oils can be really beneficial, especially if you're having a home birth, to set the birth space so that your body can go into labor. So, the ones that I see most often used are lavender, peppermint, and clary sage. All used for different reasons, all great. Do some research. I super encourage you to see which ones are going to be best for you. I like lavender, it just smells good in general and it makes me feel safe. I think it makes a lot of people feel safe in general and feel clean. Peppermint can feel really safe and bring you back to a place of knowing. So if I used to use this all the time when I was in school. I would chew peppermint gum while I would study, and then I would chew the same brand of peppermint gum during my test because it would bring me back to the place of knowing, the place where I studied. Peppermint can bring you back to a place of safety, a place of knowing my body was designed to do this. I am safe. I am doing okay. I often bring out peppermint when there is a either planned C-section or an emergency C-section or a decision to transition into a C-section. Often moms are being wheeled out of their room, and if they've created some sort of safety in that room, it can be feel unsafe leaving that room. And so peppermint in and around the body can feel good moving out. So often I'll give moms a little bit of peppermint on a napkin and put it on their chest or wave it kind of by their nose before they leave the room so that they can have one more piece of safety leaving. Clary sage, you do have to be kind of careful using tends to promote relaxation. So, again, research, see what's safe for you, see what you feel comfortable with. A lot of doulas will also walk through these different essential oils with you and help you decide what's going to be best for you and how much you need or don't need in and around your birthing space. Hand grips. This is just bars. If you see it anywhere, don't forget hand grips as a labor management tool. It's just bars or things that you can hold on to while you are laboring. Sometimes you'll see in hospitals like an actual rubber type grip around the bars in the bathroom. Sometimes you'll see them on the actual bed. I've only seen them at one hospital here in Colorado in one room, and I've been to the hospital multiple times. I only saw it one time at that hospital that there was a specific handle on the side of the bed where moms could grab, and it was considered a hand grip. These hand grips are the same as anything that we've talked about in redirecting tension and sensation into a new spot or just creating tension in a different spot of the body. Usually used during like actual pushing. So that's why I'm assuming why I saw them right on the side of the bed at that hospital in that one room. Because the only time that the mom grabbed it was when she was pushing. That's typically when they're used. Next we have Next, I have some personal comfort items. So these are some non-negotiables that I have for my own plan. And I always I always tell people to consider bringing these items with them so that they can have a piece of comfort with them at their birthing place, whether it's a hospital or even in a birth center. The first one I have is cozy blankets and pillows. I understand it sometimes can feel gross to take your pillow out of your home. However, if you saw or if you haven't seen pillows in hospitals, they're not very comfortable. They are plastic with plastic inside of them. So bring your own pillows. They can be way more supportive for your back. They can also help you sleep. Who knows how long you'll be there? Hopefully, not very long, but even if it's just one night, it might be the first night before the rest of your life with your baby. Why not have a good night of sleep with the pillow that you know? Blankets. My recommendation is to save your favorite blanket for postpartum. Let them use all the hospital blankets during your labor and birth. Bring your awesome blanket out after so that you can feel really cozy with your baby and it doesn't get yucky. This note as a labor tool is, I guess it could be used at any birth space, but I put it in this episode specifically for my home birthing mamas. If you are planning on having a home birth, have warm packs or warm, clean washcloths ready for the perineal support for when your baby descends. Ready as in you don't have to have a towel warmer in your house ready for labor. Have some clean towels ready for labor, and when it's time, have some warm water. Have your spouse, have your doula, your midwife, whatever. Get those warm compresses for the perineal support. A lot of these tools you will probably not be deciding or calling out on your own, which is okay. But the more experience you have with these tools, if somebody's not offering this tool to you during your labor, you have some availability in your body to call upon a tool that you just learned about or that you've practiced at home. A lot of times, if you have a doula, they will ask you or tell you, like, hey, why don't we use one of the 14 tools I just laid out? Because most doulas have all of these tools in their toolkit. I'm giving this to you guys so that you can be aware of the tools that might be used and actually how beneficial these can be before we look for not so natural pain relief. I have a couple more tools that I want to give you guys. These ones are more mind body. So, like I said, all those physical tools I just gave you are great. And if you happen to not have a doula, have these in your tool pack for sure. Practice them all, see which ones feel best for you, and have them ready to go for labor. If you have a doula, talk about these and see which ones work best for you. You can tell your doula, I really like this, this, and this. I'm really interested in using this, this, or this. You know which one I'm not interested in doing? This one. The more you communicate these different tools with your doula and with your spouse prior to labor and birth, the more prepared and the more confident everybody's going to be walking into your birth. So, really consider talking through all of these, practicing all of them, and then continuing to talk and practice them with your birth team. Okay, my mind and body tools that are more going to come from you, mom. So, the more that you practice these and the more that you think about them, the more available they will be during your most intense experience of life, birth. First, I have vocals and voice work, mostly just low toned moaning or groaning. If you've seen some laboring videos, oh my gosh, I just started choking. You guys missed it because I'm going to cut it. But holy moly, I'm coming back. I have a tear coming out of my eye. Oh my gosh. I just started choking out of nowhere. Anyways, that was probably my vocal work that I needed. Oh my gosh. Something stuck. Anyways, vocals or voice work. Usually low, deep moaning or groaning. If you've ever seen laboring videos of moms who are like, oh, or making crazy low tone sounds, they're not crazy. Those are really helpful sounds and tones to be making during labor and birth. Not only does it decrease pain, but it also gets your baby in the same tone as your body, or actually vice versa. It gets your body in the same tone as your baby. Your baby is going low and deep. So your body needs to go low and deep. That's my best version of low and deep, not in labor. Low and deep. I hope you enjoyed that. We want low and deep sounds. The other vocal or voice work that is not talked about, but I do want to mention is laughter. I always hear dads make really funny jokes during labor. Sometimes they're so funny that everybody's laughing and it's great, and you can watch moms kinda come out of that intense laboring experience and have a giggle. It doesn't necessarily slow labor down. Laughter is a natural pain reliever. Think about any time that you've ever laughed. Usually makes you feel nice and light and really good, not like you're in pain. So, laughter is a really good tool. I also often see some moms like look at their husbands after they say a really funny joke or say something, and like they're questioning whether they could laugh at that moment or if it's more of a like, "Hey dude, why are you laughing at me right now?" Or "Why are you making that joke right now? Like this is not the time." Don't be afraid to laugh. Just if something is funny, laugh. The more you can laugh, the more natural pain relievers that your body is going to release and send down to your body, so laugh. If you can laugh, if something comes up, laugh. The next one I have is guided meditation, which is awesome. I've seen a lot of moms use guided meditation. If you have been doing hypnobirthing, keep it up. Keep practicing those guided meditations and visualizations, because when you get to labor and birth, you can always put your headphones in, start one of those meditations, and be brought right back into that really safe birthing environment that your body knows what to do. We have full body relaxation. This one only works if you practice a lot. I think I've said this in another episode. I'm going to say it again for this episode. Practice this one a lot. You got to start practicing as soon as possible. If you're not pregnant and you're trying to get pregnant, start practicing this one. The more that you practice full body head to toe relaxation, the easier it is to pull out during the singular most intense contraction time in your body during labor. I've seen quite a few moms use this tool on Instagram and post about it, where they're having a really, really deep, hard contraction. And just almost as fast as they have tensed up, they release their whole body because they have practiced that tool of relaxing head to toe, even in intense moments. You do not have to practice relaxing head to toe during intense moments. That would be the best time to practice, but you should also be practicing this going to bed at every night, sitting in your chair at work every day. Like, can I relax here from head to toe? Even if it puts you in the most slouchy position, just try to get in the most relaxed, softest body position that you can possibly get into over and over and over and over. Because this is one tool that nobody is probably going to verbally cue you to do. Can you imagine going through labor, about to give birth, and someone tells you, relax? How well do you think you would receive that? I know for myself that I would not receive that well at all. I'd be like, are you joking me? Are you joking me? Are you telling me to relax right now? But having practiced relaxing head to toe so many times, when you're in a really hard contraction, you have the chance to be like, oh, I actually can relax just as much as my body is contracting right now. I can relax. I can meet the contraction with relaxation. Try this at home, start practicing it. The more you practice it and then practice it with the labor management practice tools I'm giving you at the end, the more available it will be for actual labor and birth. Next, I have breathing techniques. Breathing is always, always, always helpful for everything in life. Why wouldn't it be so helpful during labor and birth? Especially because you are not just breathing for one person, you are breathing for two people. A lot of times we see labor or videos of women in labor where they are in a folded position or hunched over and they're trying to breathe through the contraction. When you are in a hunched position, it's really hard for you to fill the top parts of your lung. So you're only filling the very bottom part of your lung or your diaphragm. If you have really shallow belly breathing during labor, what's in your belly still? A whole baby. It's going to be really difficult for you to get that full breath of air or the amount of oxygen that both your body needs and your baby needs if you're in a hunched position where your lungs can't fill. So, working on breathing techniques and being able to find huge, really expansive breaths in different positions can be really beneficial so that you could be birthing or laboring in any position and have access to a full, expansive breath that is just as nourishing for you as it is for your baby. I hear a lot of times that my baby didn't have a lot of oxygen, or my baby's heart was decelerating, or whatever it was, and a lot of times that's because of mom's position or lack of ability to get in a position where her body can get enough oxygen for her baby. So, practicing breathing techniques goes along with a lot of posture practices that I have within my practice at Move Moms. But breathing techniques is something that anybody can practice and start to improve today. So, start breathing, start working on different breathing techniques. You can Google easiest breathing techniques for pregnancy and get a million responses. So definitely start doing some research, start finding breathing techniques that work best for you and that feel really good in your body. Next, we have some music therapy. I put it as therapy because music is therapy for a lot of people. And I just had a new and expecting dad ask me at my Better Birth Outcomes workshop this weekend, what about music? Should we have a playlist? Yes. I really think that you should have multiple playlists. You should have a playlist for calm environment, my favorite songs playlist, good vibes playlist, golden hours playlist. Come up with multiple different playlists cuz you don't know what the vibe is going to be for you. What's going to keep you going at different parts of your labor. For me personally, I imagine that I would want this really calm, soothing environment, but I like listening to my favorite songs. If I have any chance to have control over music, I want to listen to my favorite songs. So I'll probably have a calm playlist and a my favorite songs playlist. I also want a really clean, soft, gentle playlist for when my baby arrives. So I'll probably have another playlist for that time. Having music can be so beneficial in bringing you back to that place of knowing. It's like peppermint, it's like sleeping on your favorite pillow. It brings you back to that place of safety and knowing, of comfort. Sound is just one of our five senses that you can have complete control over during your labor. Not a lot of other senses do you have complete control over. So, being able to control the sound in the room is really awesome and can feel really empowering, especially when it's your music. The last one I have is focal points. This one can get funny because I've given this tool to a couple moms in the actual process of labor, and they're like, I'm going cross eyed. So, the idea of focal points is to find something to look at in the room and focus on just that. This is really helpful for moms who don't want a ton of people in the birthing room, but there are a lot of people anyways, whether it's because they're high risk or because they were transferred to a hospital and they only wanted their spouse and their doula in the room or their midwife in the room for birth, whatever it is. Focal points can help bring in attention and focus back to one goal, which is to have a healthy baby and a healthy mom through labor and birth. So, finding a focal point in the room, something to look at, whether it's we're so lucky in Colorado. Hospital that I'm typically helping patients at is in Boulder, and in each of the labor and delivery rooms, the windows look out to the mountains. So often I have the moms look at mountains or find a mountain peak that looks really awesome to them, their favorite mountain peak that they can see from their bed. And they'll look at that focal point and they're just going to focus on that focal point and focus on their baby descending while looking at the single one focal point. This takes you out from being in your head, stuck with a lot of thoughts, especially if you have a lot of fear and worry and stress going into labor and birth. If your eyes are just looking back at all of those thoughts happening over and over and over and over, it can increase that stress, it can increase the pain, it can increase labor time. So, finding a focal point that you can look at and really focus on and really get back into your natural rhythm of labor can help the body drain out any extra sound or stimulus that's happening in the room and bring mom back to a really safe feeling in her body. Those are most of my tools. The other one that I could add on here is some acupressure, which if you happen to know specific acupressure points that can relieve pain, great, use them. Um, we have some herbal support. This is usually used for my home birth moms just because that's usually what the midwives have in their toolkit. They have really great herbology practices that can help moms go through labor, get to different parts in labor, beyond labor. There's so many different herbs that are super beneficial and nutritious and help in guiding the body through the labor, delivery, postpartum process. And then, as always, this one is never talked about because I think so many people think that you can't eat during labor and birth. And yes, to some degree, at different hospitals with different standards and rules, you can't eat or drink. When that's not a rule, eat and drink. Eat and drink. It is power. We hear about long labors all the time. She had a 36-hour labor. She had a 48-hour labor. Whatever it is, a long labor. Honestly, more than 6 or 8 hours of laboring. Can you imagine not eating for that amount of time? It's a long time to have an Olympic event in your body without any extra added nutrition or support. So having food while you're laboring only increases the amount of energy that your body's available, or the amount of energy available in your body or that your body has to continue doing the work. Now, for my hospital moms who can't typically have food or drink during their labor, which is they can usually have water. It depends on what interventions you have or if there's any medications in your body. But I always recommend honey packets. It's as close as you can get to food, nutrient dense calories without having like food. It's not a clear liquid, but it's also not a thick food. So it's a really great boost for some sugar and just energy for your body to use for actual contractions. So grab some honey packets. They have these little boxes of honey packets on Amazon. They're orange. I'm not sure what the brand is, but they're really good. Oh, I told you I would finish this episode with some labor management practice tools, and I have a couple for you to try. My all-time favorite one is ice. Get some ice, and I suggest that you do this with your spouse too, so that one, they can experience the intensity with you since they're not going to get to experience labor. Why not let them experience these labor management tools and let you guys practice together to see what you're going to have to think through, what you're going to have to breathe through, different ways that you're practicing to get through a really intense experience with them at your side. So, you both get ice in both of your hands, or you can put them in one hand, and you're going to hold it and hold it and hold it. I would start with 2 minutes as a goal time. But in those 2 minutes, and I would go dry hands. Ice is not going to kill your hands, especially if you're doing it inside of your home. It will not give you frostbite. It should melt by the time you get there. You're going to put that in your hand, hold it for 2 minutes. I want you to breathe, think through it, start thinking about different labor tools that you could be using in this moment. Would it feel good to have a massage right now? Do you want someone to tell you that you're doing really good? Do you want a comb? Do you want some acupressure points? This is not only a tool to see what tools you should be using or add to your toolkit for labor and birth, but this is a tool to see where your mind goes. Where does your body go? What happens inside your body when you get to a really uncomfortable, intense situation? Where does your mind go? Where does your body go? What does your mind need? What does your body need to overcome this scenario and stay empowered and not give up or drop the ice? This is a good practice for your brain and your mindset to just experience the intensity of life and see what your body would do or what you would want to do in response to that intensity. So, grab some ice. I suggest doing this lots of times. Do it once a week. Do it a couple times a week. Do it with your birth partner. Do it without your birth partner. What if, yeah, try it without your birth partner because heaven forbid they're not there right when you go into labor or when you're in your most intense part of labor. What are you going to do? Practicing this in all different scenarios multiple times helps you prepare for labor, but it also gives you one more tool on everything that we just talked about to use during labor. If you find that you can hold on to ice for minutes and minutes and minutes at a time and you're fine, that might be a tool for you during labor when you're feeling really intense contractions. Can I hold on to a piece of ice to reduce some of this intensity? If this becomes one of your tools, I recommend saving this tool until the very end when you get to that time of transition and you might be having some of those, I don't know if I can do this, thoughts. The other labor management tool I have for you is holding a deep squat or just holding a squat where you're just um squatted over like you're going to the bathroom in public and you didn't want to touch the toilet seat. That type of squat. Sit in that squat for as long as you can, and as soon as you think you can't do it, start a timer and try to hold it for another minute. That minute is the minute that we want to see where your mind goes, where your body goes, what labor tools would be helpful. Now that your body's actually in a physical, intense position, it's probably getting tired. This is where we want to see what deeper parts that we can dig into our bodies to keep up this position. Labor doesn't stop. And so, even though we can stop this position, we want to see if we can go beyond where we would voluntarily stop this position since we can't stop labor. Push beyond that point, do another minute, see where your mind goes, practice this with your birth partner. This can also be really beneficial in creating some strength in your lower body. How often are you practicing holding your entire upper body and your baby in an awkward position for some time? Probably not that used to it. And you might be in an awkward position if it's the position your body's called to during labor and birth for your body to birth out your baby. Using tools like this can help you go through that cycle and realize, hey, on the other side, that was just temporary pain. And I was able to push through it. Yes, labor is different. I totally understand that. But for a lot of first time moms who don't know what to expect, these are really great tools to start prepping your body so that your body can have some idea of what to expect during really intense situations like the one you're about to go through, labor and birth. The last thing I want to talk about before we wrap up this episode is affirmations because I can't believe I didn't add it into my other tools, but it really is kind of its own tool. Affirmations often go undiscussed or not talked about just because it seems like one of those obvious things that should be happening during labor and birth and does happen during most labor and births automatically. We're telling moms, you've got this, you can do this, your body was made to do this, you are so amazing, you're doing great. All these different affirmations. These affirmations from a spouse during the most intense time can be the difference between epidural and no epidural, can be the difference between intervention and no intervention, can be the difference between more pain and less pain. Having a really good understanding of what words mean to your spouse or to your birth partner can make the world of difference for your birth outcome and what actually happens. So I've seen a couple moms share about this on YouTube, and then I've experienced it with two other moms in my office. But these moms, these few that I'm talking about, were in transition, getting close to pushing or fetal ejection reflex. And in transition, were saying to their spouse, I cannot do this anymore. I don't have any more energy. I want an epidural, something of that sort. And their spouse was able to say one affirmation that they did not say the entire labor, which this isn't necessarily like just an affirmation, but just words of encouragement and empowerment, which in my head are words of affirmation. But these husbands told their wives in this most vulnerable moment of I can't do this anymore. You can do this. Your body was designed to do this. You've been prepping for this. You have done every contraction. These are multiple sentences that I'm saying at once that were said across multiple people. Um, every contraction, you have been able to do every contraction. You can do this next one. You have already birthed two amazing babies. You can do this one. All of these different phrases, or whatever it is that this husband said to these wives, was the one thing that they needed to hear from their spouse, that they had a switch or one more flip in their brain. I can do this. I've got this. And they had their unmedicated or a no prevention type birth. So, affirmations are essential, but knowing which affirmations are crucial to their actual efficacy in the labor and birth space. So, look up all the birth affirmations, create a list of the ones that you like, and then I always challenge my moms to come up with 1 to 3 affirmations that they haven't seen other places, or something that their spouse already says to them that makes makes them have butterflies in their stomach, or makes them feel really good or empowered, whatever it is. Write down 3 of your own that your spouse can use. And spouses, this is my encouragement, to start using them. Don't use them so frequently that they become meaningless, but use these affirmations in these tough times with reason. I always recommend having your own, having a list of go-to ones, and practicing them during intense times when you can. If you can practice these affirmations more frequently during intense times or stressful moments during pregnancy, it can lead into more safety, comfort in labor and birth. If you found this episode insightful or helpful in any way, please share with another mama to be. These tools are helpful for most mamas across the board, and the more that we talk about them, the more prevalent they'll be and the more efficacy that they have in labor and birth spaces. If you're loving the Popped podcast, don't forget to share, like, subscribe. We put out new episodes every Monday. I'd love to see you guys stick around for our future episodes. We have so much more to come. Thank you for sticking around for this episode. I can't wait to see you guys next time. I'm Dr. Emily, and you've been listening to the Popped Pod.